So my name is Michael Albert. I am the President and CEO for the United Way of Monroe County. And today I'm going to be talking to you about collective impact. So collective impact this concept has been around for a little while. It's not new. It's not my concept. There was a very now famous article that came out in 2011 by Kanya and Kramer from FSG. FSG is a nonprofit consulting firm. They consult with nonprofits to do efficiency around nonprofit works. And they labeled collective impact as, well, collective impact initiatives are long-term commitments by a group of important actors from different sectors to a common agenda for solving a specific problem, and their actions are supported by shared measurement, mutually reinforcing activities, ongoing communication, and are staffed by an independent backbone organization. So that's what I'm going to talk to you about for the next 15 minutes, this collective impact approach. So why do we have such an approach out there? Well, essentially, we know that there are a number of complex problems in our community. Today's all about building communities. There are a lot of complex problems that can't be solved by a single organization implementing a single initiative. We often hear about the fact that there's no silver bullet. And by the way, collective impact is not a silver bullet either. But essentially, we're saying what you need is a number of mutually reinforcing activities working together. When we work together, we can actually start to move the needle on some core issues in our community and start to solve some problems. So these are the 5 elements, this common agenda for change. We all have to get together behind the same idea. We're all working towards the same goal. Then we have to actually measure results, and we all have to be measuring the same things. We can't know if we're achieving results, the mistakes we might be making, unless we're measuring the same thing. Then we have to have these mutually reinforcing activities. That's a key part. This is the part we usually think about when we think about sort of community service work. But we need open and continuous communication, and we need a backbone coordinating organization to help that process. Most of what I'm going to talk about today is that backbone organization, because it's sort of the part that is often lacking in a lot of other collaborations that exist in the community. So collective impact, like I said, it's been around since 2011. There are lots and lots of examples of very successful collective impact initiatives out there. Lots of different organizations across North America, across the world, that are implementing collective impact and achieving incredible results. You see United Way is there in the middle. They are growing more and more. United Ways have been around for 100 years. Here in Monroe County, it's our 75th anniversary this year. But collective impact is sort of new to United Way, but later in the talk I'm going to explain why United Way is very much strategically positioned to help out with these collective impact initiatives. So first I'm going to spend a few minutes and just highlight a very specific local example of a collective impact initiative. So a year and a half ago, we implemented a community needs assessment for Monroe County and highlighted financial stability as a core issue that exists here in Monroe County. We have a very high cost of living here in Monroe County, and we have a lot of people that are making $30,000, $35,000 a year, but they're not quite making enough to get by. So we launched a number of initiatives to try to tackle some of the complex elements of that overall poverty problem, and one of them is access to healthy food. Food is a great example because it's one of those things where there are lots of activities out there. There's lots of things we can do, but it's also all about systems building. There's a lot that has to happen by lots of different players. So let me go through each of those 5 core elements. So a common agenda. So United Way, working together with a number of partners, came up with this agenda that all residents of Monroe County would have access to healthy, nutritious food, improving their well-being, health, and independence. All right, we got number 1 taken care of for the time being. Okay, shared measurement, and I should say this is a work in progress, but there was an agreement among a number of partners that these are the 5 of the core issues that we wanted to really pay attention to and measure. And essentially, we're looking at just access to supplemental food. We're looking at ensuring that those providing supplemental food, we have dozens and dozens of food pantries and food providers in this community. We want to make sure that they are providing quality and nutritious food. That there's increased awareness and understanding, so that sort of education piece for the community, but also for government leaders. Advocacy is a core component of any collective impact initiative, and so we wanted to see that as a specific measurable outcome for this initiative. And we also wanted individuals to understand the values, so there's a nutritional education component there, and then also increase efficiency of the overall food system in Monroe County. You have to have mutually reinforcing activities. There's lots of players in a food system. It's not just the food pantries that are down the street. It is not just the food bank. But there are food pantries, food providers. The school districts play a major, major role in food distribution. We have 4 school districts. 50% of students in our school districts are eligible for free or reduced price lunch, just under 50%, which is kind of staggering. So you have summer lunch programs as well for those kids when they're not in school. We have education, food bank services, corporate and nonprofit food providers, SNAP. So SNAP is what food stamps used to be. There's lots of activities there. I'm not going to go through everything. There's also, we need that open and continuous communication. So United Way of Monroe County formed a hunger coalition, which is made up of all of the different food providers in the community, and they meet on a monthly basis. There is a listserv where people are able to communicate. We have a Facebook page, we have a website to enable that sort of regular communication. A backbone organization. So United Way is playing a bit of that role, as well as Second Harvest in the Lehigh Valley and northeastern PA is playing some of that role. Now, future research around collective impact said, well, that backbone organization, it's actually really, really essential. And some other collaborative efforts that haven't had that backbone organization just aren't working. Well, what does it do? It sounds a little bit like overhead, and originally I was going to go into a whole talk about the overhead myth, but I'll leave that for another TEDx conversation, maybe next year. So there's 6 essential functions: facilitating dialogue. So again, we formed a hunger coalition. Providing an overall strategic direction. It's not United Way of Monroe County that's providing that strategic direction. It is a Hunger Coalition Steering Committee, which is actually meeting for the first time this month. Managing data collection and analysis. We actually have invested in specific software that is used for analyzing collaborative work, data from different partners. We're handling communications as it relates to we're developing website, listserv, e-newsletters to communicate with everyone. Coordinating community outreach. So we're doing social media, advertising, community conversations. Actually, just this morning, I boosted a post on Facebook for a partner organization, actually Pocono Alliance, that is going to speak later on today about a little project that they're doing related to food. So we're helping to sort of boost that, get that information out there. And then mobilize funding. So we've already been successful by coming together, working together to apply for funds. We were successful in receiving $50,000 from the Pocono Mountain Community Fundraiser, another $50,000 from All One Charities, Weiler Braces Groups, and Mattioli Foundation, and of course our annual campaign helps us to raise funds to help out with these projects. So quickly, our results in our first year. The Hunger Coalition has been formed. Social media campaign was implemented throughout all of September. Steering committee was established. Or is it being established this month? Initial funding secured. SNAP, so food stamps, we actually expanded that program. If you go down the street right now and go to the farmer's market and you are a SNAP, you have food stamps, you can double your food stamp use by going to a local market. That's a little project. We have healthier eating happening by supporting pantries to buy healthier foods. Actually, there's 22 food pantries that are receiving $1,000 grants to specifically purchase healthy foods in their communities. And grants to multiple partners have been issued, with over 15,000 individuals receiving food assistance through 250,000 meals served last year. And one just sort of little tidbit, one of the just very simple things that the Hunger Coalition did was it just published information about all the summer lunch programs that existed in the community and sent it to every single family, every single student in all 4 school districts, got just a little flyer that said, where are the summer lunch programs? And we looked, and the number of meals that were served this summer compared to last summer tripled in numbers. Now, we can't take full credit for that, but the Hunger Coalition in its entirety and all the work that all the providers are doing can take credit for doing that. So United Way is a backbone organization. What you're seeing actually, United Ways across the country, and every United Way is an independent organization, is stepping up and becoming that backbone organization. So why is that? Well, United Ways, our mission is all about building partnerships that improve lives. So we're not about raising funds for other programs. We are about building partnerships. We already have partnerships with for-profit companies, nonprofit partners, government partners. So we've got those relationships. We also have relationships with individuals, with labor, because we've been doing these workplace campaigns for 75 years. We have relationships with thousands of donors, individuals, local government, volunteers, and those that are in need. We are strategically positioned to carry out advocacy efforts. Every United Way is part of a state association, so I'm regularly in Harrisburg meeting with United Way of Pennsylvania to see what are the different advocacy things we can do at a state level. And then at a federal level, there are 1,200 different United Ways across this country, and we all work together around advocacy issues at a federal level. So that can include the EITC tax credit that working families need. Around SNAP, there's a major effort around advocacy for SNAP programs, that sort of thing. Knowledge. So we often are a lead agency that implements community needs assessments in communities, and it's important to have that knowledge, and we're happy to be able to work with partners to develop a community needs assessment and then share that with the community. And learning. So we have these 1,200 different independent United Ways across the country, and they're all learning different things about collective impact, stuff that doesn't work, stuff that does work. So it's great to be able to pull those resources together. Okay. And funding. We implement an annual campaign, and that enables us to supplement any funds that we might want to implement these collective impact initiatives. Okay. Now, I said it's not a silver bullet, and I want to just take a couple of minutes to highlight some of the challenges that might exist with a collective impact approach, because it itself is not a silver bullet. And a lot of this comes from a publication in Nonprofit Quarterly in 2016 by a fellow named Tom Wolfe that was actually a little bit critical of collective impact as approach, but I think his points are all very valid, and what's important is that we need to be cognizant of these things when we implement these collective impact initiatives in our community. So, one of the things that isn't highlighted in a collective impact initiative, and most of these things are things that aren't specific part but can be added, and I think that's important. We still need to have meaningful engagement with those people that are most affected by an issue. And it's not specifically spelled out in collective impact approach, but we need to make sure that they are involved in those conversations or leading the conversations. So collective impact was born from a top-down consultancy model. FSG is a consultant firm that sort of focuses on CEOs, and we know that top-down doesn't always work. We want to make sure we have that grassroots approach, so we have to be cognizant of that. Policy and systems level changes are not specifically highlighted in a collective impact approach, but as I already mentioned them, we consider them key activities as part of those mutually reinforcing activities that we need to make sure we implement. Similarly, social injustices are often associated with the root causes of many problems. We have social injustice in our community, and that's not, again, necessarily integrated into collective impact approach, and we need to make sure that we're cognizant of those. We identify root causes, social injustice, as a root cause for many poverty issues in our community, and see how we can integrate those things. The other thing is there are other very effective community collaboration models out there. There's evidence for other collaborations, and so we just have to make sure we learn from those as well. And there are great examples of success in collective impact, but there's actually limited hard research. There's no randomized controlled trials around collective impact as compared with other collaborative efforts. So it's something that would be great to see in the future to compare this coordination approach compared to others. Here's a big one. It has to be well funded. All those elements require a lot of money, and sometimes in rural communities such as ours, it can be hard to mobilize those resources to really make a collective impact project work. We have to remember that the backbone organization is not necessarily the leader, but they do need to help to build leadership. And again, that's not specifically often spelled out in a backbone organization's role, but we definitely see that as well here in Monroe County, that we want to help to build the capacity of our partner organizations where they're lacking, and let those that are better positioned to take on leadership roles, take on that role when possible. The other thing is, it's hard. It's really hard to implement this. The funding, you can imagine bringing lots of people together. Lots of people have different opinions. Just the first step of agreeing on an agenda item can be really, really difficult. You get everyone in the room that's together on a subject, and you'd be surprised. We're all here to end hunger, right? But people have very different viewpoints. So it can be very, very hard to implement. And then, as I mentioned before, there may be a need to incorporate additional elements in those 5 elements into an effective collective impact approach. Another one, and I highlight this a lot, especially because we have a lot of great partners implementing great programs, collective impact is about solving complex problems. There are some problems that have very clear solutions. And if there's a very clear solution, a very specific program you want to implement, then that should be the program. I used to work in malaria for a number of years, and there's sort of 5 tools that you have around malaria, and those are the programs you want to implement. And there's randomized controlled trials to show that those are effective. When there's evidence out there that a specific intervention it works in a specific issue, then that's what we should be funding, that's what we should be supporting. But when it's something that's more complex, like hunger, like poverty, other elements of poverty, you might need this collective impact approach. And then there's some problems that simply are not solvable at all, and some that require a lot of money that might not exist in a community that are not solvable. We've talked about transportation and this underlying problem in our community, and we just realized we just don't have the resources, the funding that could actually legitimately solve that problem in our community. So I do want to highlight for any of you that wants to know more about collective impact in the community, there are some incredible resources out there for collective impact. So Stanford Social Innovation Review is a great publication that regularly has articles on collective impact. Community Toolbox is not just collective impact focused, it is all about community collaborations, and they actually highlight some challenges with collective impact as well, and some other things that we should be doing. But the big one is the Collective Impact Forum, and you can join as a member for free. You can join as a backbone organization, as an organization that implements activities. And there's a whole wealth of tools, best practices that exist for implementing collective impact in the community. So with that, I essentially just want to leave you to highlight what we're doing here in this community together with our partners around this new approach. It's definitely new for United Way. Of Monroe County, we've very much been focused on being a sort of collaborative funding instrument, but more and more we are now focused on how can we serve as a backbone organization to solve these complex problems in our community using this collective impact approach. So we are all about bringing people together in our community to make it a better place, because we do have a lot of problems threatening our community. That underlying issue is financial stability, but we have challenges around homelessness, we have challenges around transportation, mental health, all sorts of things that are all very complex, and there is no silver bullet that's going to solve those problems. So we really do need to work together to fight for those people in need so that they can achieve their dreams. But the last thing to highlight is that we cannot do it alone, and our nonprofit partners can't do it alone. Companies, individuals can't do it alone. A lot of time people think the government will do this. The government's responsible for coordinating it. They can't do it alone. They're going to be very helpful in policy changes, but they need assistance. They need work from the different partners. But together, more than ever, we can help those in need today to enjoy a better life tomorrow. Thank you so much.